Amendment number 33, printed in Part B of House Report number 118-535, offered by Mr. Ogles of Tennessee.
Pursuant to House Resolution 1269, the gentleman from Tennessee, Mr. Ogles, and a member opposed each will control 5 minutes. The chair recognizes the gentleman from Tennessee.
Thank you, Madam Chair. With many veterans in my family, this is something that's near and dear to my heart, as I've seen members of my family having to drive long distances to receive care that otherwise could have been provided at home. I think of my Uncle Keith, who suffered, languished in a hospital when he could have passed peacefully with his family in his own home. The VA's medical community care program allows veterans to get the care they need from community providers to complement the VA's efforts to provide medical services to chronically ill or disabled veterans through the community care program. This amendment ensures additional funding specifically for in-home health care. If a disabled veteran would like to receive medical services from a specific VA-approved community provider, and it would better facilitate that veteran's care than other medical services, it should be a top priority for the VA. This is plain and simple, common sense, providing the best health care for those who have sacrificed so much for this country, and I reserve.
The gentleman from Tennessee reserves. For what purpose did the gentlewoman from Florida seek recognition?
Madam Chair, I rise to claim the time in opposition.
The gentlewoman is recognized for 5 minutes.
Thank you, Madam Chair. I rise in opposition to this amendment because this is yet another attempt at trying to privatize veterans' health care. Veterans have consistently made it clear that they prefer to get their health care at the VA. That is where they are the most comfortable. That is where they are served by people who have served in the military as well. And it is a culture and an environment that ensures that veterans are seen and treated by people who understand what they've been through. Multiple studies, in fact, have shown that non-VA care generally is of lower quality and higher cost. In fact, since the enactment of the Mission Act, which was designed to shift patients from the Veterans Health Administration to the private sector, costs have exploded. Between FY19 and FY24, costs for medical community care have grown by over $21 billion, or almost 140%. My colleagues across the aisle often lament that government spending is out of control. I agree that we shouldn't balance our budget on the backs of our veterans, but we can take reasonable measures to ensure that the care that we provide our veterans are not only of high quality, but are cost effective. We should not be kicking into overdrive to privatize the health care that our veterans receive. They wish and prefer to have their health care provided for them at the VA. This amendment would lead to an expansion of privatization, and for that reason I oppose the amendment, and I reserve the balance of my time.
The gentlewoman from Florida reserves. The gentleman from Tennessee is recognized.
Thank you, Madam Chair. You know, when I think about my home state of Tennessee, in particular Maury County where I reside, we have Maury Regional Hospital, which is a community-owned nonprofit hospital. The VA is over an hour away if you live where I live. If you live further south, then the VA would be an hour and a half to 2 hours away. And so you have a locally owned, community-owned hospital that is a nonprofit that could provide these same services for our veterans in our community at their homes, where they're not having to travel an hour or hour and a half to get services. So this isn't about privatization. This is about prioritizing our veterans as they seek medical care for the service they gave to their country. I reserve.
The gentleman reserves. The gentlewoman from Florida is recognized.
When you have, what the gentleman's amendment does is it encourages the privatization of in-home health care that we provide to our veterans. The difference between providing care to our veterans from the VA and providing privatized home health care is you can ensure that within the VA system that the veteran is cared for oftentimes by another veteran or by someone who is accustomed to treating veterans and understands the unique and specific needs that they have. Moving towards privatization, more and more privatization, makes it so that veterans are less likely to be treated soon, more likely to be treated with care that is more expensive, and more likely to be treated by someone who really doesn't have experience in caring for a veteran. None of those things are positive, so I urge opposition to that amendment for that reason, and I yield back the balance of my time.
The gentlewoman from Florida yields back. The gentleman from Tennessee is recognized.
Thank you, Madam Chair, and I appreciate my colleagues' comments, but I would disagree that this is simply about prioritizing our veterans. And again, I speak to my community. From where I live, the VA is over an hour away. And you can be served by your community regional hospital, your community hospital. And in rural Tennessee, most of the hospitals are community owned. And so this is about getting veterans who otherwise would be an hour, 2 hours, 3 hours away from care, letting them to be served and serviced in their community. They're our veterans. They serve the country. They have sacrificed and they deserve the best. Madam Chair, I urge adoption. Promises made, promises kept. I yield.
Gentleman from Tennessee yields. Both sides have yielded. The question is on the amendment offered by the gentleman from Tennessee. Those in favor say aye.